Hey guys, welcome to Man Medicine, where we talk about how men can optimize their health and escape the collapsing U.S. healthcare system. Well, a number of you guys have asked me to do some reviews on the various peptides that are out there that men are using to heal injuries, to gain muscle mass, to lose body fat, that sort of thing. And so today's going to be my first attempt to do that for you. Most of the questions have come around like two substances mainly, BPC-157, and then one or more of the different growth hormone secretagogues, like mostly ipamorelin or IPAM mixed with the CJC-1295. And I was going to put together kind of a combo video on both of those, but as I started going through it, I was like, man, this is going to be way too long. And rather than just, give you something superficial, I'd rather just take each one of those things separately and give you a little bit more higher quality talk and higher quality evidence. Although I'm going to try to keep this one short. It's I struggle with making short videos, so I'm going to do my best though with this one. So we're just going to talk about BPC-157 today, and we're going to talk about at the end. I'll let you know I actually have some personal experience at using it myself, at least on one occasion, and I'll share that with you guys, and I'll tell you what I think about it. So. Finding good information on peptides, and by good information I mean unbiased information from somebody who's not trying to sell you something, is extremely difficult. Just about everybody that puts videos out on the various peptides on YouTube is in one way or another affiliated with the research peptide industry, which we're going to talk about a little bit too. I'm not a huge fan of that. So it's very difficult to know, who to trust. In general, you shouldn't trust anybody that's trying to sell you something. I mean, that may not always be the case, but in general, you've got to kind of always question the source. So there's a lot of that. And then there's also a lot of just gross oversimplifications, and in many cases, just gross exaggerations as to what these peptides can actually accomplish for somebody. And in particular, they take effects that were seen in animals and just assume that they're also going to happen in humans. And as any of you know who read research studies or involved in the world of medicine, that's not always the case. Animal studies are really important. That's typically the foundation when a new drug or intervention comes on the market, but that doesn't mean it's necessarily going to be something worthwhile for human beings. Human beings are not rodents. And that's going to be the big problem with these peptides, I'll tell you up front, and especially BPC-157. So there's an extraordinary amount of good research actually on BPC-157. Almost none of it is in actual human beings. Very, very little is in human beings. It's almost always done in rodent models. Now that doesn't mean we should throw it out, because I think, as you'll see from some of the studies I'm going to show you here, I think it can still be valuable to kind of help understand at least some of the potential that this peptide might have. But again, please, you got to be careful about extrapolating animal data into humans, because we basically have almost no human data on this stuff, at least not to the level that I would feel comfortable with at this point. So with that in mind, let's talk about that a little bit. So BPC-157, this stuff has been around for a long time. It was isolated from human gastric contents, gastric secretions, I think like in the early 90s. And, it's been studied for a wide range of different effects. We're mainly going to focus on the musculoskeletal stuff today, because that's what a lot of men are using it for these days, but it really has some fascinating potential in the treatment of other conditions, not the least of which is like inflammatory bowel disease, post-surgical healing, treatment of traumatic brain injuries, cardiac issues. There's you name it, there's probably a study out there that has looked at BPC-157. So it's a fascinating compound. I think we're just starting to scratch the surface on its full potential. So it is a peptide. So what is a peptide? It's just a series of amino acids linked together that have some sort of a biological effect. Most of the peptides that you'll see for sale out there, or the ones that were available at compounding pharmacies, they're either identical copies of something that already exists naturally and has a function in your body, or it is a slightly modified version of that designed to have a more amplified clinical effect, or maybe a more specific clinical effect than the natural peptide that your body makes. But these are not, they're not weird substances that are unknown to nature, I guess is what I'm trying to say. Most of these peptides that are out there are naturally occurring in your body. And, there's over 100 peptides that are currently available in the US that have been used for decades for treatment of a number of different conditions. The most obvious one is insulin, and all the different ways that they have tweaked the insulin peptide to have different effects, and particularly in terms of onset of action, half-life. There's short-acting insulin, there's long-acting insulin. I'm not going to go into that, but peptides have been around forever. And BPC-157 and these growth hormone peptides, they've also been around a long time, but for whatever reason, they're kind of coming to the surface again, and they're becoming more popular, I think, as the general public finds out about these. And, the bodybuilding bro forums are alive with all kinds of discussions about peptides for body recomposition and that sort of thing. So just keep in mind, peptides are not some weird esoteric thing that's brand new. They have been around for a long time. Now the problem we're having in the United States these days is the FDA recently implemented and presumably is enforcing their new biologics law. Now prior to that, which I think it came into effect just a couple years ago, compounding pharmacies could produce these different peptides, including BPC-157, including all the growth hormone secretagogues, and a number of other ones that we're not going to get into today. And so there was a reliable, safe, high quality, sterile source for pharmaceutical grade peptides that were relatively inexpensive. So now that this FDA biologics law has come into place, predictably, it's not like people have stopped seeking out these various peptides. They've just gone to what's essentially like gray market sources. And so now the most common place that men obtain these peptides is at these various research chemical company sites, where they can just buy them without any sort of medical supervision whatsoever. And so really this law has, I think in my opinion, has caused a lot more harm than good. And unfortunately, big pharma at this point doesn't seem terribly interested in these, probably for financial reasons. So this law has taken away the only sort of clean source for these peptides, unfortunately, and now these research chemical companies have filled the gap, and they're providing substances which may or may not be of pharmaceutical grade quality. So, and that's what I want to talk a little bit about next. So this is just one of, if you go to Google and you just Google, Google peptides or Google research peptide companies, you'll come up with, I found at least a dozen. This is just one, Peptide Sciences. This one seems to be popular on some of the bro bodybuilding sites. And, they do have BPC-157. That's actually almost everyone that I looked at of these companies all sold BPC-157, either in oral or in injectable format, in addition to, in some cases, like dozens of other peptides. And as you can see here on the left here in the menu, you can see the long list of peptides that this particular company sells, and there's even more in there. And this is what I want to point out to you guys. This is how, so the way that these companies are able to legally do this is because they put a disclaimer on their website, and the disclaimer is some version of what you can see right here, where it says all products on this site are for in vitro research and development use only, meaning in vitro, so not in vivo, not in your body. They're meant for in vitro use. And the products are not for human consumption of any kind. They say it right there. So, they bill themselves as research chemical companies, implying that, the people that order from these websites are legitimate, researchers who are conducting medical and biological research. And some of their clients may in fact be. However, I have a feeling that probably 98 to 99% of the people that order from this are ordering these substances for individual use. It's just that's just the way it is. So, but that's why these are available through these sources, at least for the time being. I have a feeling that this loophole is going to get closed at some point, but they maintain their business because they say, hey, we're not selling this for individual use. This is only for scientific researchers or people doing research in that in that particular field. Of course, they don't ask you to provide any credentials that you're actually like a legitimate researcher or medical doctor or PhD or anything like that. They'll sell these to anybody. Anyway, they say here U.S. made products, 99% plus purity guaranteed, and that indeed may be the case. This particular website and most of the ones that I found offer a certificate of authentication, saying that this is 100% pure product or 99% pure, whatever the case may be. The thing is, like, with Photoshop and a good printer, like I could whip up something that looked just as good as that. So I'm not saying that that's what they're doing, but you just have to be careful. You don't know where this stuff is coming from. Odds are the bulk powder is coming from China, and then it's put together at a facility in the United States. Now, is that facility a sterile, facility with high quality instruments that has good quality control, or is this in your buddy's basement? There's no way to know. So, this is unfortunately one of those situations, just buyer beware. I strongly encourage you guys not to use peptides that come from these research companies, mainly for this reason, because you just don't know what you're getting at this point. It could be completely legitimate and completely safe. It could be totally unsterile, and it could have absolutely nothing in it that is on the label. It could be, it could be just inert powder, for all you know. But it could have, heavy metal contamination. It could have anabolic steroids in it. We don't know. There is a lot of research out there where, people have looked at black market and gray market supplements, and they have analyzed them for their contents. And those studies are actually pretty interesting because they show that a lot of the products that are out on the market, not only pharmaceutical products, but also nutritional supplements, do not contain what is on the label, not even close. This is just one that I thought was pretty interesting. It's a little bit older. It's from the Journal of Mass Spectrometry from 2008. It's a review, nutritional supplements cross-contaminated and faked with doping substances. So in this case, they analyzed a whole bunch of substances, mainly from different supplement providers in Europe, but also the United States, which I highlighted here. And they found that, at least for the United States, for example, of the products that they looked at, 18.8% of them had detectable levels of one or more prohormones. So, prohormones used to be a big thing until they got shut down by the FDA and DEA. Prohormones like androstenedione and there's dozens of other ones that I can't pronounce. Prohormones typically, when they go in the body, are converted into an active hormone to some extent or another, and have some sort of a biological effect. But they've been shut down. They're not legal to use in competition. But they mention here in the abstract too that not only have these studies shown prohormones to be present in many of these supplements, but also just like outright anabolic steroids. So they said here, since 2002, also products intentionally faked with high amounts of classic anabolic steroids, such as stanozolol, boldenone, unpronounceable something testosterone, oxandrolone, etc., have been detected on the nutritional supplement market. Yeah, and that's true. That's true. So again, it just gets back to my original point that you just don't know for sure. If it's not coming from a legitimate pharmacy, either in the United States or ideally somewhere in the Western world, you really don't know what's in that vial when you inject it. So again, buyer beware. So having said that, let's get on to some BPC-157. So BPC stands for Body Protection Compound. As I mentioned, it was first isolated in the early 90s from a gastric aspirate And it is I think it's a 15 amino acid, I want to say 15, maybe 12 amino acid peptide that has some pretty fascinating properties to it. It's become extremely popular in the bodybuilding world, primarily for the treatment of musculoskeletal injuries and soft tissue injuries, muscle tears, ligaments, tendonitis, that kind of stuff. And there is a robust amount of literature, which I'm going to show you just a small sampling of, at least in animals, that shows that it does have a clinical, or can have a clinical effect in those conditions. But again, as I mentioned earlier, it has some fascinating potential to treat other medical conditions. One of the main ones is inflammatory bowel disease and fistulizing diseases, like specifically like fistulizing Crohn's disease, which is a terrible condition. It may have some potential there. But again, very, very, very few human studies. Overwhelmingly, these are all rodent studies. So if you're a rodent with Crohn's disease, things are looking good for you. There's hope. The studies with rodents looked at a lot of different ways to deliver this particular peptide. Now, the bodybuilders out there and the people using these research peptides, typically they use it subcutaneously. And when I use this, I used an injectable form of it. But there is oral. An oral version of BPC-157. And, I was initially pretty skeptical when I heard that. I was like, there's no way that a peptide taken orally is going to survive through the GI tract in the highly, acidic environment of the stomach, and then, moving on into the small bowel. And there's no way that that's going to remain intact and have a clinical effect. But at least in many of these rodent studies, when they would put the BPC-157 into their drinking water, there was definitely a clinical effect. They used it. There were studies with looking at burn healing, and they used like a topical cream that had BPC-157. That had a clinical effect. And then they obviously used an injectable form. They actually injected it into the peritoneal cavity of these mice. So it was absorbed systemically. Why they just didn't do a subcutaneous injection, I don't know, but poor rats got a big intraperitoneal injection. Most of the stuff I'm going to show you guys today comes from this particular study from Cell and Tissue Research. It's a 2019 article, so it's relatively recent. Gastric pentadecapeptide, body protection compound BPC-157, and its role in accelerating musculoskeletal soft tissue healing. So really pretty good article. And it nicely summarizes the research that we have to date on this subject. So let's talk about tendons and ligaments. Injuries to tendons and ligaments are particularly problematic because of there's limited blood flow to those tissues. So they heal very slowly. Any of you guys that have had an issue with tendonitis, or you've had a partial ligament or tendon rupture, that you're not a surgical candidate for, will attest to the fact that it can take a long time to get over these kind of injuries. And this is where BPC-157 has potential to potentially shine. So we'll talk about some of the ways that they think that BPC-157 might help, but I think it's important to understand when you have an injury like this to a tendon or a ligament or any kind of musculoskeletal injury, you progress through basically three, grossly speaking, three different stages of healing or repair. So you have this acute inflammatory process. So you sprain your ankle, next day it swells up like a grapefruit. That's the acute inflammatory process. It's very painful, very tender. And then you have the process of regeneration. So we start recruiting fibroblasts and we start putting down collagen. And then as time goes on, generally many, many months, sometimes longer, you get some remodeling of scar tissue. You get replacement of some of the original collagen with maybe some type 1 collagen. And so you end up replacing some of the healthy tissue that you had with scar tissue, which is not ideal because, scar tissue, one, it takes a long time. And many times with that scar tissue, the integrity is just not as good as the original tissue that it's replacing. So that can be a problem, and it can set you up for repeated injuries, like repeated ankle sprains and that sort of stuff. And the full process, like I said, it can take months to sometimes over a year to fully recover, or at least recover as much as you can on your own. From a serious, ligament or tendon rupture or tendon tear. It's just the way it is. I know I had grade 3 ankle sprain on my left ankle when I was 18 years old. It still bothers me to this day. It's still painful. I still have some instability there. It's just something I've learned to deal with. So, in what part of that process does BPC-157 act? It probably affects all three. We do know that it has some anti-inflammatory properties, but we know for sure that in that regenerative phase, it can be quite helpful for recruiting and activating fibroblasts, which are responsible for laying down type 1 collagen and creating scar tissue. This is an article here that talks a bit about that. It's from the Journal of Applied Physiology. This is 2010. The promoting effect of pentadecapeptide BPC-157 on tendon healing involves tendon outgrowth, cell survival, and cell migration. So it affects all of those different properties, and we're specifically referring to fibroblasts here. So this is kind of a cool chart here. This is cell outgrowth from tendon explant. So that just means that they took, like, excised a bit of a tendon, and then they put it in a dish somewhere and exposed it to BPC-157, and it shows the growth of the fibroblasts in there. And obviously with BPC-157, there's quite a bit more of that that was clearly stimulated by the BPC-157 versus the controls. This one here this is also an interesting slide from the same paper, and it shows here they used a red stain to stain fibroblasts that were migrating through a semi-permeable membrane. So at the highest dose of BPC-157, you can see all those little red dots are fibroblasts, and they were actively proliferating, and they were actively migrating and moving, trying to cross this semi-permeable membrane. And the differences are pretty obvious between the high dose BPC-157 at 2 micrograms per mil and then the control group. So there is definitely an effect there. And they said here, quote, the result indicated that BPC-157 could accelerate cell outgrowth from the tendon explant. In addition, the total number of tendon fibroblasts from the explants after 7 days of incubation was significantly increased in the BPC-157 group, as was the number of fibroblasts seen migrating, right? That's kind of just what I just said. So, so pretty impressive. This one is, I think, even more impressive, actually. So from the same paper, in this particular study, they actually, they lacerated the quadricep tendon of these poor mice or rodents, and to simulate like a to simulate like a quadricep tendon rupture. And typically when you tear a muscle, or rupture a tendon, it's at what they call the myotendinous junction. So it's where the muscle and the tendon meet together. It's a bit of a weak point, and it's an area that is subjected to generally pretty high force. And so that's typically, if you're going to have a tear, I mean, sometimes it can rip off the bone. That does happen, where the place where the tendon attaches to the bone. You can have a tear within the muscle belly itself, but a lot of times it's in that myotendinous junction. So, for example, like I had a pretty severe pec tear in my early 20s that pretty much ended my powerlifting career, and that's exactly, on imaging, that's exactly where the pec muscle tore. So I have a nice little defect there. It wasn't bad enough that I wanted to pursue surgery for it. But maybe if I'd had some BPC-157 back in the day, back in the mid 90s, maybe I could have healed that up a little faster. But this picture here, what you're looking at, it's kind of hard to sort this out if you're not used to looking at stuff like this. But in this little a here, and then capital B. So little a is the control group mice, or this mouse. You can see where the black arrow is. There's like a lump of tissue above it and then some tissue below it. Well, that's right where they made the cut. Okay, that's the myotendinous junction where they lacerated that, and you can see the muscle like pulled away, and there's a gap in there. So it should be together, but now there's this gap, and the gap is exactly where the little arrow is pointing. So now the one next to it, they actually put in the same injury, but they gave these rats orally. They did BPC-157 over the course of 6 months, and essentially they fully reestablished that myotendinous junction there. They didn't have to do surgery. Essentially, those tissues regenerated, and these mice, you can't even tell that there was a defect there, as opposed to the control group, which the defect is obvious there even 6 months later. So pretty impressive, like just visually looking at that. So not only just from a gross visual standpoint did things look markedly different between the two groups, but under the microscope the tissues look very different as well. In the control group, there was obviously there was a lot of scar tissue that was put down, the type 1 collagen, but there wasn't very much of it, and it was a bit disorganized. So when you lay down a scar, and especially in an area that's under tension, you want all the collagen fibers kind of lined up and all going in the same direction to increase the strength of the tissue. Well, in the absence of BPC-157, the body does the best that it can, but those tendons, some of them are going the right direction, some of them might be kind of off to the side, which compromises or potentially compromises the integrity and the strength of the tissue in the long run. But in the setting of BPC-157, not only did they lay down a lot more of this type 1 collagen, but it was much better organized. So many more of these collagen fibers were oriented in the right direction, and the result was actually a stronger interface back at the myotendinous junction. Now, whether it was as strong as it was originally, I don't know. They didn't really look at that, but there was obvious differences, not just grossly, macroscopically here with this photo, but under the microscope too. There was some like major differences that were evident in the treatment group. So I don't know. I thought this was a pretty impressive photo. And again, there are a lot of other studies I found too, and just for the sake of time, I didn't include them, but showed very similar findings in other parts of the body as well. So one of which was the Achilles tendon. So this is the next one here. This is from the Journal of Orthopedic Research back in 2003. BPC-157 accelerates healing of transected rat Achilles tendon and in vitro stimulates tendocytes growth. So this particular photo is also, I think, fairly impressive. So on the left here, just to orient you guys, the Achilles tendon here on the mouse looks a lot like the Achilles in a human. Down at the bottom, you have the calcaneus bone there where the Achilles tendon inserts onto the bone itself. You have the length of tendon, and then it gets up into the musculature of the calf. So what they did is they made a 5 millimeter cut, or a cut 5 millimeters above the calcaneal insertion. And then one group was the control group. Obviously, they didn't get anything. And then they gave BPC-157 to the other group of rats. And then 4 days later, they looked and saw what happened. So the bottom picture, there wasn't obviously much of a change here. So what we're looking at here is, so DE means distal end, so towards the foot. PE means proximal end. And then TD is the tendon defect. So you can see on the bottom one, the mouse that did not get BPC-157, the tendon defect is still pretty impressive. Like it's, maybe it's healed a tiny little bit, but it's obviously still there. And then the one that got BPC-157 though, look at the size of the tendon defect, TD. It's this little tiny little space there. So that's a pretty impressive change, especially just in 4 days. I was actually kind of shocked to see that. So yet another study showing enhanced healing in traumatic wounds, at least in rats, in the setting of BPC-157. So, I think that was kind of interesting. Okay, what about human studies? Well, as I mentioned, there's not a whole lot out there, but I was able to dig up this one rather sketchy study. This is from Alternative Therapeutics in Health and Medicine 2021. Intra-articular injection of BPC-157 for multiple types of knee pain. So the reason I say this was kind of a shady study, one, there's not very many subjects in it, and it was a retrospective chart review, on patients that, received BPC-157 into the knee joint over the course of a year at this particular clinic. So they only had 16 patients. 12 of them got intra-articular BPC-157, and then the other 4 got BPC-157, and then also another peptide. Yeah, they got thymosin beta 4. So they decided, in those 4 patients, for whatever reason, they mixed both of those peptides and then injected them in the knee. To my knowledge, this is the only study out there on intra-articular BPC-157. It's not FDA approved for this or for anything else for that matter. So they just decided to give this a go and then publish their results. So anyway, the group that just got BPC-157, at least in this retrospective review, they seem to do better than the group of only 4 that got the combo. So they said 12 had received only BPC-157. In this group, 11 of the 12 patients had significant improvement in knee pain, whereas 1 patient had no improvement. Now, they don't really tell you like what they meant by significant improvement in pain. They just called these people up a year later and asked them if they're better or not. So that's why this study is kind of garbage. But it's one of the few that are out there. So it seems plausible that intra-articular BPC-157 could be beneficial. But we seem to be getting decent results with subcutaneous and even oral administration in some cases. So, there is some risk to intra-articular injection. So for God's sakes, please don't do this at home. Unless you've gone to medical school and you know how to do a proper sterile intra-articular injection, don't be putting needles in your joints, guys. And if you need any further reason not to do that, just Google septic knee arthritis and read about that and look at some of the photos. It's not pretty. So I see quite a few people with septic joints in the emergency department, and every single time it's a huge deal. So now I mentioned that there were some potential other uses for BPC-157, and just in the interest of time, we're not going to get into them, but this is a paper here, Current Medical Chemistry, 2012, focus on ulcerative colitis, stable gastric pentadecapeptide BPC-157, and they go through the use case in an animal model for the treatment of inflammatory bowel disease, specifically ulcerative colitis, but they also talk about fistulizing Crohn's disease. And there did seem to be some pretty significant improvement, not only in healing fistulas, which are notoriously difficult to heal on their own, but also in clearing up ulcerative colitis lesions throughout the colon of these poor rats. So it seems to be something that I think it certainly warrants further research because, inflammatory bowel disease can be mild in some cases, but it can also be absolutely life-threatening in a devastating condition for a lot of people. So if there's something, in addition to all of the other immunomodulatory meds that are out there, if there's something, on the horizon that could be helpful, that I think it's definitely worth looking at. They mentioned in this article too, that BPC-157 is shown to accelerate healing of gastric ulcers that are caused by taking too many NSAIDs like ibuprofen, naproxen. So you got to be careful with those. There's possibly a benefit in recovery from traumatic brain injury. I also found some articles that I didn't include, again, due to time constraints, showing effects on improving congestive heart failure symptoms, in reducing the incidence of cardiac dysrhythmias, and improved healing and recovery after myocardial infarction, again, all in animal studies. So, BPC-157 might be one of these catch-all substances that can be used in a lot of different cases. But the bulk of the data, I would say in terms of the animal data, the strongest data appears to be in the musculoskeletal realm. So, if you decide to use this, that's probably what you should stick to, and because that's where most of the data is, at least for now. So okay, what's the optimal human dose? Nobody knows. If we're going to extrapolate from the rat studies, the equivalent human oral dose, if you're going to take this orally, is they think 1.6 micrograms per kilo. Okay, 1.6 micrograms per kilo. So you have to do a little bit of math and figure what that is. It's probably once a day, but we don't know for sure because a lot of these rats receive this stuff in their drinking water, and obviously rats drink out of their little bottles more than once a day. So you might need to be dosing this repeatedly throughout the day. It might be once or twice. We just don't know with the oral dosing. At least I couldn't find anything specifically that gave me some guidance on that. And then, for the subcutaneous injection route, which again is probably what most guys are using, There's no good data on that. If you look at some of the bro forums, they generally talk about like 200 to 300 micrograms either once or twice a day subcutaneously. And it doesn't have to be at the site of the injury necessarily. It could be somewhere else. And, there should still be an effect from that. So just keep in mind, we just don't know. This 200 to 300 mics dose is pure speculation. It's educated guess, So, okay, what's been my experience with this? Well, I did get a prescription for BPC-157 a number of years ago before the biologics law came into effect. And I got it because for over 20 years, I've had recurrent bouts of lateral epicondylitis on my elbow. So right where the extensor tendons insert right there on the bone, constantly is flaring up. Originally, like in my 20s, it would happen in my powerlifting days when I was lifting heavy, but now mainly it's from jiu-jitsu. So we were hitting arm bars like crazy for a week or two at the place where I train, and it really flared up. And, I immediately recognized what it was because I've been through this before. So I have this kind of recovery protocol where, I ice it, I rest it, I modify my activities. I got some acupuncture, I do some massage on it and stuff. And usually over, like a month, 6-8 weeks, I can get it to go away. Well, this time it wasn't going away. And after 6 months of this, it was still just flared up. Part of it was my fault. Like I'm not gonna cut back on my jiu-jitsu training. So I just couldn't get this thing to clear up. It would get a little bit better, and then I'd be stupid, and I'd flare it up again. And anyway, after 6 months, I was like, I got to try something else. So what I did is I got a hold of some BPC-157 that was prescribed to me. And I injected it right into the common extensor tendon because I know what I'm doing as a physician. You should not do that. Do not put needles into tendons or anywhere near a joint. Stick to subcutaneous if you're going to do that. But in my particular case, I know what I'm doing, and so I chose to do that. I probably didn't need to do that, but I didn't know any better at the time. But I have to admit, by about week 6, this thing was about 95% healed. And that's after 6 months of just really not much forward progress at all. So in my little N of 1 study, it did seem to help. So take that for what it's worth. And I had no side effects from that, which kind of brings me to one of my conclusions here. The side effect profile, as far as we know from BPC-157, is extremely benign. But again, these are animal studies, right? So none of the rats died from BPC-157. But, rats can't really tell you how they're feeling necessarily. So they didn't notice any obvious detrimental effects from these injections. In the few microscopic human studies, there were no major adverse effects that were significantly different than placebo. So this does appear to be, at least on the surface, a safe substance. But I say that with a huge grain of salt because we do not have long-term studies on this stuff. We don't know the best way to use it, to dose it. And it very well could end up being hazardous, for all I know. We just don't have the studies on it. So I hope we do someday. I don't know if we will. It all depends on, unfortunately in this country, a lot of research has to come from big pharma, because there has to be a financial incentive to study certain things, unless a researcher is lucky enough to get, an NIH grant or something like that. And, those are few and far between, right? We got to pay for. No, I'm not going to say it. I'm not going to get political on this channel. Let's just say our government has other spending priorities right now than finding out whether BPC-157 is going to help heal up your sore tendons and elbows. So having said that, again, we just need more studies on this. If you decide to use BPC-157, I think you just have to understand you're doing so at your own risk. In particular, if you're getting this from a research peptide company. I would love to hear from some of you guys that are outside of the United States, and I have had listeners reach out to me from all over the world, which has been pretty cool. I've really enjoyed communicating with you guys. The laws I'm sure they're different over there. If this is something that is available to you in your country, please let me know. And if you have any of you out there have experience with this, either from these research companies or whether you've gotten it from a pharmacy, I would love to hear your experience, pro or con, we can go from there. So I'm going to cover additional peptides for you guys in the future. I'll probably go over some of the growth hormone peptides. Maybe not for my next video. We'll kind of see, but it's on my list. I promise I will get to it for you guys. And I do have a limited amount of personal experience with those as well. And as always, I'll be candid and share that with you. But for now, let's leave it at that. Appreciate you guys always, and I will talk to you next time.